Thank you for joining me today. Please prescribe. In this video, we are going to learn more about pharmacokinetics for the transdermal patches in a psychiatric patient with cognitive decline. If the patient becomes older, do the skin change? Do the skin absorption change? How the medication, how the transdermal patches absorb, especially when the skin get older, when the patient is cognitively decline. So we are going to learn all that. We are going to learn and explain pharmacokinetic principles of a transdermal drug delivery system in older adults. We are going to describe age-related skin changes that affect transdermal medication absorption. We are going to learn how the severe cognitive impairment affect medication adhesiveness and pharmacotherapy selection. We are going to compare pharmacokinetic impairment affect medication adhesiveness and psychotherapy selection, compare pharmacokinetics property of a commonly prescribed psychiatric and neurological transdermal medication. We are going to recognize a patient and medication specific factors that alter absorption and efficiency and safety. We are going to learn how to monitor adverse effects, drug interaction, application related complications in geriatric patients. We are going to learn apply evidence-based prescribing principle for transdermal medication in dementia and other neurological disorders. We will learn we are going to learn how to develop an individualized treatment plan that integrates caregiver education, medication safety, and interdisciplinary care. The management of a psychiatric symptoms in older adults with severe cognition decline present a unique clinical challenge. Patient is confused, and also they have a psychiatric disorder, progressive impaired memory and judgment and language and insight often compromises medication adhesiveness and increase the risk associated with psychotropic associated with oral psychotropic medication. This include missing doses because they are confused. They will miss doses. They could accidentally overdose and take more. They could aspirate the medication. They may have difficulty for swallowing. So when the patient is having a psychiatric disorder and they also confused, their memory is impaired, their judgment is impaired, their language is impaired, their insight of knowing the risk and benefit is also impaired. That often compromise the medication that affects their ability to take their medication, and that increase the risks. It increases the risk associated with oral psychotherapy. It increases the risk of missing doses, accidentally overdosing themselves, aspirating to the medication, swallowing difficulties. So, transdermal medication deliver systemic approve and alter route of giving these medications that may improve adhesive to the medication, taking their medication, simply modifying the medication regimen, and maintaining a relative stable plasma drug concentration. So that's why it's good to prescribe the transdermal medications. Several medication relevance. There's a several medication that relevancy psychiatric, geriatric, psychiatric, and neurological. Those include cholinesterase inhibitor, pain medication, are available transdermal format. Although relatively few psychotropic medication are currently delivered transdermal, so few psychiatric medication are delivered transdermal, but pain medication are delivered transdermal, nicotine, pain patches, also are delivered currently deliver transdermal. Understanding the psychokinetic of this route is increasingly important as a new delivery technique routine to emergency. So transdermal route to the medication, it eliminates the aspiration, swallow difficulty, overdose medication, or missing medication, because you will apply in the body or the back or shoulders, and already you know the dose, and that will deliver stable medication concentration. So successful use of transdermal therapy require understanding of age-related changes. What are the age-related changes that happens to the skin that affected the transdermal medications or drugs? Skin integrity can change, Environmental influence can affect caregiver responsibility, can also happen. And so, what are the skin changes that happen to seniors? Or what are the skin changes that happen with age? Skin related changes that happen include skin thinning of the epidermis, reduction of lipid content, flat of epidermal contraction. These changes decrease the drug absorption. So when the skin becomes small, thin, when lip or fat concentration becomes less, when it becomes flattened, it affected the drug absorption, how you can absorb the drug through the skin. So reduction of the collagen, reduction of elasticity, reduction of blood flow to the skin that carry out the drug. Sweat gland function is decreased. Sebaceous gland activity is decreased. All this affects the medication observation and affects drug delivery. Dehydration in the skin also affected drug observation. Dryness will reduce the batch to adhere or attach to the skin. Medication absorption will, because if the batch is not attached to the skin and the skin is dry, it's hard to absorb the medication. Also, batch can increase the irritation of the skin of fragile skin. When you attach to that the batch, it can irritate the skin. Temperature and the heat can also affect how the transdermal drug absorb. Heat batches or electric blankets, fever, hot bath, all that sunlight, all that can affect how the medication is absorbed through the skin. Patient and caregivers should avoid applying external heat directly over the batches. So you have to educate the caregivers if the patient is confused not to apply any heat to the batch. Severe cognitive decline and medication management. Patient with advanced neurocognitive disorder frequently experience memory impairment, inability to follow the direction, dysphagia, behavior resistant oral medication. They refuse to take the oral medication because they have a poor judgment, functional dependency. So the transdermal therapy can reduce the medication administration difficulty, but generally require caregivers to supervise. So advantage of transdermal therapy include improved adhesive to the medication or taking their medication. It will reduce the difficulty of swallowing because you don't have to swallow. It's taking the medication through the skin. You will have stable plasma concentration. It will also eliminate the GI side effects of the medication, and the dose schedule. You don't have to always take medication orally, but there is a limitation, and those limitations are delay onset of the action, because transdermal medication is not absorbed quickly to the system. Continue drug observation after the patch removed. It can cause skin irritation. Patch, as we mentioned before, it can cause skin irritation, detachment of the patch. You can lose the patch. All this can happen when you are taking the transdermal medication. There is different patches. Alzheimer mean batch is indicated for dementia, Parkinson disease dementia, and Alzheimer. Thank you for joining me today. I would love to see you in my next video. Thank you.